Good afternoon or good morning, depending on what part of the city you live in. No, I'm kidding. I'm gonna go back to pre-med 3, week 3, which is the nervous system. Now, I want y'all to just remember, we went over this yesterday, and that's the parts of the nerve. All right, this is the synapse, the space between the nerves, and that's how impulses jump from one nerve to another. Now, this is the stimulus. It's got to receive a stimulus in order for it to work. Remember, afferent takes the impulse toward the body cell. Efferent impulses take it away from. If you remember E for effort, efferent, and exit takes it away from, all right? Pretty smart, not too bad. Anyway, let's see. I want to make sure we kind of remember this. Whoops. Two parts to this nervous system. The central nervous system, which goes straight down, brain and spinal cord, all right? And I can show you that somewhere back here. Yeah, right there. Brain and spinal cord, okay? This is the central nervous system right here, brain and spinal cord. These nerves that come off of it are the PNS. Look, peripheral nervous system, central nervous system, brain and spinal cord. Peripheral is everything else, all right? Okay, remember we talked about a lot of parts to the peripheral. You have cranial nerves, you have spinal nerves, all right? And that's them right there, anything that comes off of the spinal cord. Now, you also have parts that are called sympathetic and parasympathetic. These kind of work together to balance each other out. Have you ever seen a seesaw in a park and little kids are on it? It takes two. You have to have one on one end and one on the other for it to work. If you only have one child, he's never going to get up, okay? Going to be sitting on the ground for a long time. All right, so these kind of, like I said, they're antagonists. You know what an antagonist is? Okay, your cousin's coming over with her children. You haven't seen them in months. And when they first walk in, your kids are like, oh, yes, I missed you, I missed you, I missed you. Then they go in the room and they go start playing. And about 20 minutes later, it's, quit touching me, stop touching me. You're playing with me, don't break my toy, put my toy there. That's antagonist, okay? All right, so here we go. Two parts of this peripheral nervous system are the cranial nerves. You have 12 pair. And spinal nerves. Remember, you have a 31 pair. All right. All right. Vocabulary. I hope you're kind of going over this because this is real good stuff. Okay. Go and if we have time after, we'll go over it. I want to start with the actual notes. All right. The nervous system. And the nervous system is made up of the brain and spinal cord, just like we said. And it's like a telephone system. It communicates their nerves. And you have over 100 billion nerves in your body. Wow. Believe that? Okay. And they coordinate activities. Neuron. Some things are highlighted. Neuron is the medical term for a nerve cell. Come on down to the next star. All neurons possess the characteristic of being able to react when stimulated and to pass the stimulus along to another neuron. Here's what the three types of nerves we have. Sensory, which is feeling, okay? And it's going to carry the impulse toward the spinal cord. You feel first, then you react, all right? The second type is motor, which is movement. And these are efferent. They exit the brain, all right? And it's going to carry the message from the brain and spinal cord to your muscles and glands. We never talked about this one, but there's one called neuroglia. Now, I want you to look at the term neuroglia. Neuro, we know, means nerve. Glia stands for glue, like school glue, all right? And this type of neuron does not carry an impulse, but it has, go back up to where we highlighted right here. It has the characteristics of being able to. So the neuroglia kind of does not carry an impulse, but it's connective in its function. It helps keep the neurons together, all right? Okay, let's flip the page. This is the peripheral nervous system. You should have everything highlighted, all right? And most of the stuff is not coming from this note, just coming from the vocabulary word, which you didn't hear that from me. Okay, the human body is composed of two main communication systems. Endocrine system, okay, I don't know if y'all gotten into that yet. Endocrine system tells glands when to secrete hormones. And the nervous system. Nervous system is made up of your brain, spinal cord, and nerves. It's classified into two major divisions. CNS, which is the central nervous system, brain and spinal cord, and PNS, that's a S, I made a boo-boo, peripheral nervous system. The central nervous system, or CNS, is the brain and spinal cord. Peripheral nervous system is all the nerves outside of the brain and spinal cord. You have 12 pair of cranial nerves, and they're in your book. You can see exactly where they start and where they go to, because you're going to have to be especially careful dealing with patients' mouths, because you have facial nerves, all right? Let's see, cranial nerves, you have 12 pair. Spinal nerves, you have 31 pair. Then we also have that autonomic nervous system. It looks like automatic because it practically is. All right, central nervous system. We're going to come down to right here, right there, all right? The brain consists of several structures, and you can see this in your textbook. All right, the brain consists of several structures. The cerebrum, which is the largest part, all right? The thalamus and hypothalamus. Remember, body temperature and water balance. Then you have the cerebellum, the pons, and the medulla oblongata. These three parts make up the brain stem, all right? Now, the cerebrum is the front part of the frontal lobe in the brain. Have you ever wondered why kids from maybe the age of 10 to 20 really don't make good decisions sometimes? I mean, you know, they'll think, well, nobody's out. I'm here in my car. I can drag race if I want to. And then he broadsides somebody, all right? The reason they don't make good decisions, and you'll ask them, why did you do that? I don't know. No, why? They really don't know. Because the frontal lobe controls your thought process and your decision making. It is not fully developed until you're in your mid-20s. That's why younger people make crappy decisions sometimes. Not all of them, but some of them do, all right? Okay, let's see, next page. It says see the table on table 10-1 for the functions. All right, the cerebrum, here we go, is the thinking part of the brain and also responsible for memory and judgment. We just talked about that. It's also the largest part of the brain. The outer nervous tissue of the cerebrum is known as cerebral cortex. Remember cortex, whenever you hear cortex has an O in it, then outer, okay, it's outer tissue. The cerebrum is divided into right and left sides, and each side is known as the hemisphere. Now, you do know the left side of your brain controls the right side of your body, and just vice versa. The right side of your brain controls the left side of your body, okay? That's why when my mother had the strokes, it was on the left side, and it affected the right side of her body, all right? The cerebrum also contains CSF. That stands for cerebrospinal fluid, all right? In the ventricles of the brain. The heart has ventricles, you know, pumping it around, but you also have ventricles in your brain. CSF is clear, colorless fluid that acts as a trauma buffer. This is what they withdraw when they do a lumbar puncture and they go in and they remove some of the fluid to test for meningitis, all right? But there's cerebrospinal fluid going around all the time. The thalamus and hypothalamus, two important parts in the middle brain. The thalamus perceives pain. Oh man, mine must be working overtime. And the hypothalamus, osmosis Jones, controls body temperature, fear, and pleasure. Oh, isn't that great? Okay, see where I have brain stem? Look at that, how cute it is. Brain stem, all right? Made up of three parts. It's made up of the cerebellum that coordinates voluntary muscular movement, and it also makes sure that you're steady, all right? Your balance and your posture. The pons, the word pons means bridge, and that's exactly what the pons does. It connects the cerebrum and the cerebellum to the rest of the brain, all right? Then we have our good old friend, 40-something-year-old girl walking around Monroe, Miss Medulla Oblongata. This actually connects the spinal cord and the brain, all right? But remember that foramen magnum is the hole in the skull where the spinal cord comes from the brain down to the spinal cord. The medulla contains three centers, or three things that it controls: swallowing, respiratory, and cardiac vasomotor. Cardiac and vasomotor are not the same thing, but that's why I said three. Because cardiac is the heart, vasomotor is the movement of your blood vessels, and that's all kind of clumped into one category. All right. It affects the muscles located in the walls of your blood vessels, and it helps with blood pressure. If you've ever had hiccups, that's why I put that there. That's the part you want to blame, the medulla oblongata, because it made this diaphragm, which is what separates. Wait, I'll show you. Your diaphragm. All right, diaphragm is about right here, and it's just a thin tissue that separates the thoracic from the abdominal cavity. And if that goes into spasms, you're gonna have hiccups. And I guess you can blame the medulla oblongata because it controls that part. All right, the cerebellum, pons, and medulla are collectively known as the brain stem. All right, spinal cord and meninges on page 353 in your book. The brain and spinal cord meet at that foramen magnum, which is an opening located at the base of your skull. That was put there. It's meant to be there. But any other holes or openings in your skull, no, not good, all right? The spinal cord, part of the central nervous system, is a column of nervous tissue extending from the medulla all the way down to your second lumbar vertebrae. Remember, lumbar is that area in your back. Hold on, I'll find it. Here we go. Yeah, lumbar is that area in your back that kind of curves at the bottom. So here we go. You have cranial nerves right up in here. Okay. Then you're coming down. You have 8 cervical, 12. Read backwards. 12 thoracic, 5 lumbar. That's that kind of, call it the small of your back. It's where the back curves. That's the part of the back that gets injured the most. All right. Let's see. The cerebral. Where it was. So they're all collectively known as the brain stem. Brain and spinal cord meninges. First one that's highlighted. The spinal cord, part of the CNS, is a column of nervous tissue extending from the medulla to, again, the second lumbar vertebrae. The spinal cord carries all impulses from your limbs and lower body to and from your brain. The central canal space is where the cerebral spinal fluid is, all right, the CSF. Now, remember the 3 layers lining or covering up the spinal cord and protecting it? Well, here we go. You have the meninges. The meninges are 3 layers of connective tissue that surround the brain and spinal cord. Connective tissue, if you've ever had ribs and it has that white skin still on it, that white, tough white, you have to cut it off. That's connective tissue, okay? But in us, we don't want to cut it off, all right? Okay, here we go, the 3 names. First one is dura mater. It's the outermost. That's in the vocabulary as well. It's the thickest and it contains blood. The arachnoid is spider-like in its shape. It's the middle layer, and this one contains the cerebral spinal fluid. The little pia mater, I don't know why, I always think of a little ballerina, like it's so delicate. I don't know why. Oh, look, delicate, I'm sort of. It's delicate connective tissue with a very rich blood supply. It is the innermost layer and closest to your brain. That was central. Let's start going over peripheral nervous system. Central is just the brain and spinal cord. Now we're going to talk about the nerves that come off of it. Cranial and spinal nerves are composed of nerves that help the body respond to changes in the environment. Okay, what do we have? We have cranial and spinal. Cranial nerves, there are 12 pair, all right? They carry impulses between the brain, the head, and the neck. Okay. Spinal nerve. These nerves branch off of the spinal cord and carry messages to communicate with structures within your chest, your abdomen, and your extremities. Like I said yesterday, when you swallow, you don't have to say, wait, I kind of concentrate. I have to make the nerves in my esophagus move the food down. No, you don't have to say that, all right? Okay, let's see. There are 12 pair cranial nerves, spinal nerves, 31 pair, all right? And I'll list them for you right here. You have 8 pair coming off on each side. 8 pair of cervical. Cervical means neck. Then you have 12 thoracic. Thoraco means chest. And if you put your hand here and went back around, that's where it would be. Then you have lumbar, 5 lumbar. That's the part of the back that's injured the most. Then you have 5 sacral, which actually are 5 bones that fuse together. And then remember that little bitty sucker that's no bigger than the end of my fingernail? That's the coccyx or coccygeal. You fall and break that, it's pillow time. All right, the makeup of the cranial nerves and spinal nerves. They contain sensory, or the ability to feel, and that carries the impulse toward your brain and spinal cord. You feel it first, and the impulse goes up. Remember the hot pot? Same thing. All right, they're afferent. Afferent means to add to, if you can remember that way. Motor nerves move. They carry the impulses away from efferent or exit, away from the brain and spinal cord to your muscles and glands. The peripheral nervous system, that's how it's abbreviated, also contains what's called the autonomic nervous system. It is getting, just work on the vocabulary words. This is a large group of nerves that function automatically. Then it looks like autonomic automatically. These nerves generally carry information away from your CNS to the glands in the heart, blood vessels, and involuntary muscles, and your intestines. Autonomic nervous system, right here at the bottom, okay? They balance each other out. That's where I told you you have the sympathetic or parasympathetic. What I have in capital letters at the end of sympathetic is fight or flight. You're in bed. It's 2 o'clock in the morning. You're home by yourself. All of a sudden you hear this loudest banging on your front door. Now, some people are going to pull the covers over their head and pray that it goes away. It's called the fight or flight syndrome. Some people are going to get a baseball bat and go downstairs and find out what it is. But guess what's happening to your body? Your mucous membranes are drying up. In case you have to run, you won't choke on your saliva. Your pupils are becoming dilated. Automatically, all this happens so you can see better if it happens to be in the dark. Your digestion slows down, so you don't have to stop and say, oh, I have to make a potty break. Wait, hold on 1 second. Dry mouth. All right? And the sympathetic and parasympathetic, they work together, all right? Parasympathetic is involuntary, autonomic nerves that regulate normal body functions. Your heart rate, breathing, and muscles of the GI. GI tract is gastrointestinal tract. And notice how tract is spelled. It's not like a railroad track. It ends in a T. All right, that's not a mistake. All right, now I highlighted that they act as a balance, sympathetic and parasympathetic. you're running away from Bigfoot or something in the forest, all right? And like I said, all of these things, your mouth dries up and your pupils get big and you actually breathe more, your blood vessels dilate to carry more oxygen, everything to help you get out of harm's way. You go downstairs with the baseball bat, you're standing at the door. You finally get up the courage and the nerve to open the door, and it was somebody threw a newspaper. And yes, they still have newspapers. The guy threw the newspaper and it hit your door that hard. All of a sudden you're going, oh my God. Thank God that's all it was. Am I right? Oh yeah. But by this time you've got a major headache. Okay, I would anyway. So it's like now you have to calm down. That's how they act in balance with each other. One gets you up there where you can get out of harm's way, and one brings you down so you can come back down to earth, all right? Okay, pathological conditions. Now, the pathological means disease causing. So these are conditions that can occur with the nervous system. The first one is known as hydrocephalus. I'm watching the red dot. Hydro means water. Cephalo means brain. What it is, you may have heard people call somebody a waterhead baby. That's what they used to call them when I was younger. But this is in too much cerebral spinal fluid in the brain cavity. Now, your skull is a bone, okay? It's gonna grow, but it's gonna only grow a certain amount. If you have hydrocephalus, the brain wants to continue to grow. You're gonna have the brain pushing on the skull, and it's gonna cause mental retardation. What the doctors can do is they put what's called a shunt. You know how we have the interstate I-10, but you have the 610 bypass and the 310 bypass? That's what a shunt is. It diverts the extra fluid, all right? So, and now they have to be changed usually like every 4 or 5 years. But if it's caught in time, the child's brain, if it's not, and the skull enlarges a little bit to accommodate the brain, that size will never go down, all right? If it's caught in time and it's fixed, nothing. The baby, as a teenager and adult, their head and skull will look the same as everybody else's. The next one, Alzheimer's disease. This is senile dementia. It is chronic. Chronic and acute. Chronic means long-term. Acute means short-lived. So it's chronic. And it is progressive and degenerative. So it's going to degenerate the brain. It is going to progressively get worse, and it's chronic. You're not going to get rid of it. Okay, they still haven't come up with something for Alzheimer's. They're working on it. Next one is epilepsy. Epilepsy is a disease of the nervous system characterized by mild or violent convulsions. The DT means due to an increase in the discharge or the firing of those neurons in your cerebral tissue, causing convulsions. And please don't say they're having a fit. That is so wrong. But there's 2 types of convulsions: grand mal seizure and a petit mal seizure. Grand mal seizure, you know the person's having a convulsion. They're on the floor. They're just, when that occurs, I know you've heard them say, they're going to swallow their tongue. It is impossible to swallow your tongue. See that? It keeps you to friendle them, keeps you from swallowing. Now the tongue is muscle, so when you're all like this, the muscle's going to relax and the tongue can drop back and block your airway. But you cannot swallow your tongue. Do not put anything in the victim's mouth. Do not try to hold them or pin them down. They have superhuman strength at this time, all right? Do not try to hold them down. The petit mal seizure, you could be sitting in a classroom and somebody would be having a petit mal seizure and you'd never know it because it looks like they're daydreaming, all right? So that's the types. You have grand mal, petit mal. Cerebral or cerebral palsy. This is a disturbance in the voluntary muscles, okay? Or the spinal partial paralysis, possibly caused by hypoxia. Hypo means low, oxy is referring to oxygen. That's a lack of oxygen or blood flow during pregnancy in the uterus. The definite cause, though, is really unknown. Let me tell you something. People with cerebral palsy, it tells you right here, it's voluntary muscles. Muscles they can move, not the involuntary ones, like your stomach and your intestines and all. People with cerebral palsy may be in a wheelchair, and they may have spastic seizures where they just don't the muscles don't work, and their head may be over. They look different, but ladies, their brain is just as good as anybody else's, and I despise it when somebody's pushing somebody in a mall, which I don't go to anymore, but they're pushing them in a mall, and somebody comes up and they start saying, "Oh, talking to the person pushing the wheelchair. How long have they had that? Oh, what do they do about it?" That person understands, okay? They may speak a little differently, but you're talking about them over them. So, no, okay? Shingles, oh Lord have mercy. That's eruptions, oh, big, 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 big eruptions on the skin with pain along a nerve, all right, around the trunk of the body. It's a viral infection related to chickenpox. Now, what it said right here is it is along nerves. You will see somebody with big, big, big blisters, and it's not all over, it's just running down a nerve. What you see on the outside is nothing compared to the blisters on the inside that's actually on the nerve, all right? Okay, I hate to do this, but we're going to stop because this red light is flashing like crazy. So tomorrow we're going to pick up with meningitis, encephalitis, convulsions, and this vocabulary, and go back over the other vocabulary. And Miss Makia, if you could, I think I didn't check my email, but if you could email me what you sent me on the iPhone or phone, that would be great. Okay. So I don't know anything about tomorrow yet, whether school's open or not. I'll have to find out, and as soon as I do, don't make plans. All right. As soon as I find out, I'll let you know. I'm gonna send this to you all and work on intro. Bye, love.